Hello everyone, I'm here back. I hope you listened the lecture, and I'm not good at this IT communications, so I'm sorry if anybody missed up anything. So I'm here to answer the questions, and if anybody is having hello, yes. So this was a quick concept about uh, the rhythm, the cellular mode of communications, and the alpha waves are the resting waves in our brain, 8 to 12 hertz, and in our body also the skeletal muscles are 8 to 12 hertz. So when they combine, our body is in a state of complete relaxation. If the rhythm, it depends upon which level. Like if the cellular level, then it is like the cells craving for oxygen, if the rhythm gets interpreted for the short duration of time. So it is indicating some necessity. That's why you know that if there is a lot of drainage system in our body is as a healer within. It starts the physiological shivers, as you know. If I'm not wrong, if you have seen the shivering of Lord Shiva, if you remember, he shivers. Actually, what is that shivering? It is just drainage of the lymphatics within your body. Shivering, your natural shiver is also physiological tremors. Rhythm gets interrupted by if the extracellular matrix is not good for the cell. If it is not healthy, the environment of the cell is not healthy, it stops vibration, because for vibrating a cell needs to be alive. For alive, it should be having the energy, oxygen supply and all. It depends, like the supply of the oxygen. Does this rhythm affect with age and gender? No, actually the rhythm doesn't differ. Rhythm is the same. If you can see the yogis or those who are in spiritual path or like that, they have vibrant force in their old ages as well. How? They activate their energy centers in the body. See, as I told you, the rhythm as a whole, you have to first check which part you are, take a detailed assessment. And after taking an assessment, if, for example, a person is having the frozen shoulder, so after frozen shoulder, you can check there is stiffness in the shoulder as well. And you have to check the musculature around. The musculature might be adhesive over there, and might be tight, or may develop spasm because of the pain and all. And as I told you, the pain is the cells, the tissues crying for oxygen. So what you have to do, you have to improve the circulation first. As I told you, that you need to first take a detailed assessment, and our activation should be followed by passivation. But if at the level of activation everything is done, so you no need to go for the passivation. There is a lot of importance of rhythm in physiotherapy. Rhythm is there, so you need to activate either by an passivative device, or you have to by your hands. As I told you, that your hands are first thing which are getting interacted with the patient. What is the role of the core concept of the cellular mode of communication in physiotherapy practice point of view? All activated vibrator to use tension. Okay, very good question. So see, the core concept of the cellular communication in physiotherapy is very important, because as I told you, we should not see body as a macro. We have to think about micro and see the connectivity. And after seeing the connectivity, you need to check out the things like even though there are a lot of vibrators and electrotherapy devices available in the market, but the delivery of what you have to deliver to the cell, it should be similar to 8 to 12 hertz. The vibrator should be 8 to 12 hertz. If it is not 8 to 12 hertz, it's not going to work at all. Yes, yes. Does rhythm affects our thinking abilities and our personality? Yes, it is, because as I told you that the alpha frequency of the brain, your personality is also depending on the rhythm of your body. If your body is in a good rhythm, your personality matters. If it is not in a good rhythm, so you are not in a railed way. You are derailed from the natural things. As I told that a rhythm is not affected by the age and the gender, no. Yes, bipolar disorders may develop a rhythm. Rhythm may be affected by that as well, because there is always the coordination of the alpha waves and the rhythm of the skeletal muscles. There's a lot of effectiveness of matrix rhythm therapy in frozen shoulders. I think in one to two sittings it's done. And as I provided you with the website, you can go over there and check out over there. Show MRT is useful in physiotherapy. MRT, matrix rhythm therapy, is very helpful in physiotherapy nowadays, because lots of research have been done, even in diabetic ulcers, even in chronic conditions, in muscle tightness, and even in, I have treated a patient. I would have shared the video, but I didn't take permission from the patient. It was 26-year-old gunshot injury patient from Yemen. She had a gunshot injury at the cervical level, where she had developed the quadriplegia, and then she was only able to move her head, not the shoulders, not from the cervical level until down, nothing. Everything was like paralyzed, quadriplegic. But we started giving matrix rhythm therapy on the paraspinal muscles, and eventually we got a good result, and in 1 month she was able to move the hands and arms, and shoulder movements were present, hand movements were present, and she had the sensation up to T12. But because of lack of medical faculties over here, we had sent her to Delhi. She is in Indian Spinal Injuries Center. She is getting that further treatment over there. As I told you that to check out the abnormality in the body, you need to take a detailed assessment. After taking a detailed assessment, then you have to think from the micro to the macro and see the connectivity of the condition. The connectivity should be considered. It's not you are taking only, like I told you that yesterday I saw a very good lecture in which he told that the shoulder, a person was complaining of shoulder pain, but his tests were positive, everything, range of motion, everything is fine, but he's still complaining of pain in the shoulder. So it was connected to the gluteal muscles, and because of the connectivity of the muscle chain. So it's very necessary that after taking the assessment, think about what you need to particularly emphasize on, whether cell or anything. By meditation, chakra activation, can anyone regeneration occur by forcing the energy rhythm within the body? Yes, of course, by activating the chakras, because it's out of subject now, but I will still speak on it. you can activate the chakras, and the chakra is the activating chakra means liberating the energy, the spiritual energy within you, and getting in, regenerating your body with that. That is also one of the very important thing. Physiotherapy helps in restoration of rhythm by giving the proper on-spot treatment. Like for example, a person is suffering from tennis elbow, so we start up giving the treatment activation. So activation, you are first of all giving, if I talk about the rhythm, rhythmicity, so either you can give by external device matrix rhythm therapy, or you can start up the soft tissue manipulation. After soft tissue manipulation, you can go for the modulities and then start up activation of the extensor muscles. Rhythmic disorder can be determined by either, for example, sleeplessness in the night. So alpha rhythm is not in a good position. You are having body cramps, body aches and all. So skeletal muscles are yearning for oxygen. Okay. So as I told you that a detailed assessment will always show you the right path for the treatment protocol. Rhythm usually is blocked by the external cellular matrix. I told you that if the extracellular matrix is not good enough for the cell to get the nutrition and the oxygen properly, then the cell dies, or the tissue gets adhesive because of this. Chest physiotherapy is a sort of vibration, but even though you are, that's why I told you that physiotherapist's hand is the magical tool. So when you are touching, so body, we are connected bodily. That's why I'm telling, we are connected bodily, biologically. Okay, we are connected biologically. So when you are touching anybody, so it feels that somebody is going to take care, but it depends upon your touch. If you are touching very harshly to the patient, so he tells that yes, I know this touch, but he is grasping, so the mind is telling that no, I cannot. As Dr. Mahinder Yadav and Dr. Saurabh Sharma particularly told, that you have to psychologically motivate the patient first. You have to talk very calmly and gain his confidence, then you can start up the things with him or her. The rhythm can be assessed by, it depends upon what kind of rhythm you are going to check. For example, when there is any sort of pathological condition, so the rhythm is not present. So there is any problem in the rhythm. So when you are taking an assessment, again I'm coming to the assessment, like for example, I'm having a pathological condition, so you are assessing me. After taking the assessment, I feel that there is some problem in the knee joint. So problem itself is indicating you that the rhythm problem is also there, connected, because you are seeing a joint, but I am seeing a cell. In burn conditions, post burn, you can go ahead, but not directly to the skin. You can go around the skin for improvising the circulation and all. Yes, rhythm, your rhythmicity is also connected, because I told you everything is connected. As I told you that the connection is that the question is, first I will read the question. The disturbance of rhythm and all, does it have any relation with the chakra healing and the Reiki? Chakra healing and Reiki is entirely different. Chakra healing is something like you use Reiki for the chakra healing, but when it comes to the rhythmicity of the body, it is the rhythm of the body is connected to your energy sources. Your energy sources are your 7 chakras. Okay, and these 7 chakras are in turn connected to the DNA helical, where the energy is stored, which you have been carrying throughout. Yes, rhythm can be, this matrix rhythm therapy can be used in case of stroke patients and Parkinson's patient, and it is having a very much effective result. I had a patient with hemiplegia with a chronic synergy pattern, and the synergy was broken. I broke the synergy with the help of matrix rhythm therapy. Not only matrix rhythm therapy, I told you activation should be followed by passivation if it is necessary. If it is necessary. So even when your body is receiving an external protocol external protocol of 8 to 12 hertz, it's in turn, as I told you, it is everything connected. When the skeletal musculature is receiving 8 to 12 hertz externally, so it goes, the signal goes to your brain, the thalamus, and thalamus is also activated with the same frequency. So whatever is applied to the body, it travels within. So the traveler, that's why I told you a physiotherapist has to be a traveler as well. So I am getting a lot of questions, very nice, but I will suggest you, I will again show you my, because time is limitized. So I am going to share my WhatsApp number. You can write out your questions and I will be happy to answer. Again, I am switching the screen. So this is my cell number and WhatsApp number. You can write it down. Any questions, any queries, I would be happy to answer each and everybody. So before I conclude, I thanks once again for the students. Even I am also a student, so I am also learning from these questions as well. So I may not have answered maximum of you, but still I will try to answer you through my WhatsApp and all. And I thank you all, and I wish you safe and healthy life, and stay blessed. And thanks a lot to Dr. Ravinder Kumar Mudgil for inviting me to speak on rhythm over here. And I thank you very much, and all the best, and God bless you all. Thank you very much.